Okay, okay, yeah. So, speaking of passive voice, if you look at the model examples, right, from E2 and swoosh, they use a mixture of active and passive. If we go to, I guarantee you now, if we go to the E2 blog and take a look at some of the samples, a lot of the instructions on the letter are actually written in active voice. I prescribed, I did, etc. Passive, you use it when you want to put the object, the patient at the beginning of a sentence, because that's the more important information. So you would use a mixture of active and passive. But if
exactly.
you write everything in kind of passive and it's not appropriate, then it won't work, will it? I mean, in terms of passive, it's like, say you don't know who performed an action, right? So say you're a doctor at a hospital. So you would use, Mr. So-and-so was admitted, because we don't know who admitted him. Presumably it was a nurse, but we don't know. So you would use passive then. Or if you're, if you're like a member of a clinical team and you don't know who assessed them, you don't know who did, etc., then yes, you would use passive because you don't know who performed the action, and the patient is more important. So you need to use like a mixture. So all the different forms are only useful when appropriate in the letter, and it's all about clear, effective communication. I posted a couple of, I shared a couple of posts in the group yesterday. One was from E2 and the other was from Swoosh. And they were regarding the upcoming changes to the writing section, which, comes up at the end of August. And the new criteria of purpose, and they've renamed the other criteria. So the original 5 criteria are still there, but they've just changed them. They have a slightly different name, and they've included this new one of purpose. But what the article said, in essence, it's all about clear, effective communication. Not, is it written in passive, is it written in active? It's all about that. Clear, effective communication. The reader, it should be perfectly clear what you want them to do. Mm-hmm. If it's not clear, then it's not effective. And, your score will reflect this accordingly. That's what you've got to think about. It's all about clear, effective communication. Not, have I included more passive uses? Have I included modals and conditionals, blah, blah, blah. It's an English test for sure. But the grammar should serve the purpose of the letter, not vice versa. If you say, don't include things because I have to put a conditional, I have to put in this. What you put in should merely be a way to reflect the message, the information that you wish to convey, and not the other way around. Really, So that's the most important thing. It should be clear to the reader what you want them to do and the reasons why you want them to do it. If you can achieve that, you should be fine.
Okay. Kevin, can I ask you a simple one question?
Sure. Yeah, sure.
Yeah. Can we write like this? A cesarean section has been performed. Though cesarean section has already performed in the past, okay? But we can write like this: a cesarean section has been performed.
It depends if you know when. So you use the simple past if it's definite time. If either in the sentence or in the surrounding context, we know when the past action, which is finished, occurred. If you do know when, so it doesn't have to, yeah?
In the sentence, I have not written the time frame.
So right, so if we don't know indefinite time, it would have to be present perfect then. Yeah.
In the case note, there is a time frame, but in the sentence, if I have not written the time frame, so I think it's better to write the present perfect. Right?
Well, unless it's somewhere in the context, in the paragraph, if there's a previous mention, a hint, a clue as to when, then, so if it's definite time, it's simple past. If it's indefinite time, present perfect.
Okay.
So if you don't specifically say when the past action occurred, if nowhere in that paragraph, in the context, does it say or hint when that past action occurred, you would have to use the present perfect. Or, or like present perfect, a continuous, or past perfect, or whichever, depending on how the rest of a sentence is, but you can't really use a simple past if we don't know, if we don't know when the action occurred.
Mm-hmm. Yes.
Okay. Anybody else got any questions? Because I've only got 4 letters to have a look at, so I might as well take a couple of questions first, because it won't take me long to look at 4 letters. Does anybody else have any questions? Ray, I see that you're here. Have you got any particular questions you want to ask? Mesa? Sachin? Ray. I thought you might have something. Hi, man. All right?
Hello. Can you hear me?
Yeah.
Hi, everybody. And also, Kevin, thank you so much for your time. I want to tell you and the other candidates that I have passed the exam. You know that I've passed the writing exam. Initially, I got 300. After your advice and of getting some letter correction from you, I've got a 390. Okay, and in 4 letters, you mentioned that I will be getting A, B, 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 and finally I got the B score.
Mm-hmm.
I'm going to tell the other candidate that the way of your teaching and the correction letter are excellent. It's not only for your presence, that just only is real, because I've compared the way of teaching from you or the others and the benchmark to everything else, that I applied everything that you told me before, and everything was excellent. And I've got exactly the score based on the way you taught me before. That you taught me. This is important, yeah. And just now, I'm going to resit the exam. That's what, just only for 340 for listening. Unfortunately,
right.
Yeah.
Thanks, man. Thanks. I appreciate your.
By the way, it's a real experience from my side. That's the only. That was not the question. Just only for. It was everything okay. for you. Yeah, that's it. Yeah.
Well, thanks, man. I appreciate it. You saw the posts that I posted on Telegram about the criteria.
Yes. Yeah, I checked them.
It's basically, as I've said all the time, it's like purpose, so they've actually said it now. They've actually said it in most of the posts to say, don't just simply say, I am referring blah, blah, blah. Yeah. What does that mean? Referring the patient for what?
Exactly. Exactly. It was 3 or 4 months back. I can remember that I was involving with the practice for the writing, and you mentioned that this one, because in one of my letters, I didn't mention the one, and you emphasized at that time that you have to mention and put the sentence exactly in after I'm writing to request for what. So I did the same in 3 or 4 months back, and now they are going to be tested and just highlight this point again. Yeah.
Well, it seems, I would have thought it was an obvious point really to make, because as I mentioned, I'm not using the case notes now in videos, because I had some legal issues with E2 and OET online using their case notes in videos. Now, I've put a disclaimer now, usually when I do use case notes, because it's purely for teaching purposes, it's educational purposes. I don't make any money out of that. All I do is I comment on people's writings based on what the case notes were. In those particular cases, they were under copyright and they objected. So I took a couple of videos down, but I'm not taking anything else down. They can try and sue me in Eastern Europe and see how far they get, which won't be very far. However, that aside, my point is that I don't use case notes now because your letter, if you've written it correctly and it's a good letter, I shouldn't need any case notes. Because if your purpose of writing is clear, I want you to do X, Y, Z because blah, 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 blah. And you know, if you've explained it in a complete way, I shouldn't need to look at any case notes.
Sure.
Because you should have told me, you know, I want you to do this for this patient because of this reason, because of this happened and this happened, etc. So I shouldn't actually need it. So I don't use them now. Maybe I might write some of my own, which I will use for a future lesson or a demonstration. So the point is, as I was just saying to Sanjog there, that it should be, it's all about clear, effective communication. Don't try and impress the examiner with structures or complicated words, etc. Dr. Shamir in the group, he made a comment earlier today, this afternoon. He took his test a while back. He passed it, and he said that all he did was use simple language to clearly communicate his purpose, and he passed. He didn't have to use any complicated phrases or expressions like a couple of people posted today. Somebody was using a negative adverbial, such as not only did he not do this, but he also didn't do this. Some like complex, that's called a negative adverbial, so they put in that. And, as he said, you don't actually need this. The best way to impress the examiner is to be clear and effective. So there's no ambiguity, there's no doubt in the reader's mind exactly what you want them to do and why you want them to do it. If you can achieve this aim, you will be fine. So that's it, basically. Anyway, Ray.
Thank you.
Thanks, man. Let's just check. I've got 4 letters. We're going to have a look at that. Now, if anybody's got any questions afterwards, I'll come back to the end. Question here from Sanjog. Had a history, well, has or had, it depends. Has means he still has a history. Had a history means it was in the past and it's finished with. So besides a history of fall, injury, that's not phrased too well in any case. Anyway, let's get on with these and we'll come back. I've got a bit of time left, I think. So, Mr. David Taylor, X38, I wanted to refer Mr. Taylor, who is diagnosed with a damaged medial cartilage. He requires your service to remove it so as to prevent further osteoporosis. Okay. Well, I would be tempted to make this a single sentence. Mr. Taylor, again, we've got referral, but what is it that we want, what is it you want the reader to actually do? My service, what is my service? To remove it. So I'm writing to what? Request your surgical attention to blah, blah, blah. Referred for further care. What does that actually mean? So this is a good example of this is a good example of what we were speaking about in terms of purpose. What is it, what is it that you want the reader to actually do? Anyway, I will be tempted to make this a single sentence. I'm writing to refer Mr. Taylor, who is diagnosed with damaged medial cartilage and who requires your service. And he, so I would join these into a single sentence using and or who, so as to prevent further osteoporosis. Regarding Mr. Taylor's social history, he's a landscape gardener and consumes alcohol. Well, don't we all? So what? And smokes for 20 to 30 cigarettes daily. Well, that's irrelevant. Right, the point of this letter, and I'm not going to show you the case notes, but the point of this letter, I remember from the notes, Mr. Taylor's a gardener, right? That he's the main income earner in his family, right? He is the man who earns, there's nobody else. So as a gardener, he needs to be able to use his legs because he's outside, he's digging, etc. So the main thing here, I seem to remember, who cares if he smokes or drinks? It's about his knee, right? He needs to be able to use his legs because he's a gardener and he's the main income earner of his family. So that's the main point. That's the important thing. Not that he consumes alcohol, you know, so what? Not that he smokes. That doesn't have a relevance to the issue here. That's a side issue. It's a secondary issue. The main thing is here, he needs to get his legs or his knee sorted out because he needs to work. He needs to earn some income, make some money. That's it. Everything else is secondary. So this letter should reflect that. Okay. And also, don't include stuff unless you're going to use it, unless you're going to draw some conclusion or it has a inference, something, you know. So if it said like he smokes 20 to 30 cigarettes and he's having problems breathing, which is affecting his ability to work, okay. But it's not about that. It's about his knee. He's got a dodgy knee and he needs to be able to use it so he could work. That's it. Okay, Mr. Taylor came to a clinic with complaints of knee joint pain and swelling. He reported symptoms stuck with his leg while playing what? I think it was football. I don't know. It was managed with painkillers. On the examination, tenderness was present in the medial aspect of the knee. Therefore, he was prescribed Voltaren and advised to reduce smoking. Now, okay. So I come in. Oh, doc, I've got a pain in my knee. Oh, and by the way, stop smoking. What does that have to do with the pain in his knee? Nothing. So be a bit careful there what you include. Okay. Mr. Taylor represented with intermittent attacks of pain. The swelling range of motion was impaired. An MRI was ordered for him and was right. Who was asked? Right now. Okay. So we've got lots of passive here, right? Who ordered the MRI? Who ordered it? You did. So why is it passive? Why is it passive? All right. So this is an illustration of overuse of passive. Now, Sanjog, as we were talking about use of passive, and I said when appropriate. So it sounds here as though, oh, some random guy ordered him an MRI. Well, no, you, the author, writer of this letter, that's the person who ordered it. You know, so he was prescribed, an MRI was ordered, and was asked. So who was asked what? Who was asked to review? Now, if you're a doctor, do you ask your patient to come back? No, you tell them. You're the doctor. You say, okay, I want you to come back in a week and let's have a look at it. You don't say, oh, will you please come back in a week? You tell them, don't you? Right? So, and also was asked to review. So how this reads is that the patient was asked to review. But in fact, you asked him to come back so you could review him. But how this reads is he was asked to review. Review what? So not so good. So this is a good example of how overuse of passive doesn't quite work. This sentence, it's not clear. Okay. Upon review, the results of the MRI, that should be capitalized, showed a damaged medial cartilage, and that should be 1L, I think, yeah. Although the pain decreased, swelling and limp. Limp was present, limp, or a limp? You mean he was limping? Right, right. A limp cannot be present, all right? You can see a bump, you can see a bruise, you can see a swelling, but you can't see a limp. He's got to actually walk, and you can say, oh, look, he is limping. So that, it doesn't work, right? So again, right, look, overuse of passive, it's just not working, right? And limp, so he has a limp, okay, it's countable, but limping. So although the pain had decreased, I would probably make that past perfect. A swelling, although the patient reported his pain had decreased, I noticed a swelling and the patient was limping, or he mentioned he was still limping or had a limp or something. But how that's written, that doesn't quite work. His condition making him anxious. Right now, this is the key point. This is the crux of the matter. That's it, right? He cannot work. That's the main thing. And he's gained about 5 kilograms recently. In view of the above, Mr. Taylor has been referred to you for further care, which means what exactly? What is it? Okay, so that's a good example. Good example there. So let's have a look at this next one. Mr. Seymour, who is insisting on a consultation with a rheumatologist. His features are suggestive of gout, and he requires further care from your healthcare setting. What exactly is a healthcare setting? You mean a clinic? Healthcare setting? Don't think so. Or from you. So Mr. Seymour has a family list of RA. I would spell that out, spell out your abbreviations, and is a heavy drinker. Oh, and that's not spelled right. How do they spell rheumatologist? Yeah, that's it. His regular medication, is it medication? Well, there's more than one, so it should be medications, his regular medication. And why is it included? Has he stopped actually taking them? No, so make it includes if it's regular. His regular medication, so if it is regular, right, it should be present simple, not the simple past, because it's not finished. So his regular medications includes, or his regular medication includes colchicine, indomethacin, alcohol, for the recurrent episodes of inflammatory attacks. Okay. Initially, on the 25th, Mr. Seymour came to the clinic with a swollen large left toe, which was painful. Only one L is painful. How do you spell inflamed? Is it, can't remember. Is it only one M? Yeah. And red in colour. He reported that he discontinued, that he had past perfect, because we've got the simple past here, reported, and past perfect there. So this outlines a sequence of events. Now, had this continued, past perfect is farther back in time, reported is closer in time. Okay, so he reported that he had this continued non-compliance. We don't use that anymore. Apparently, we use non-adherent instead. Non-adherent, because non-compliant implies unequal doctor-patient relationships. So non-adherent. Therefore, he was prescribed with an advice to get medication up to good doses. Was also advised regarding his diet and to decrease his alcohol intake. Okay, so there's passive, passive, passive here, but again, you know, you can use some active voice. I mean, didn't you prescribe? You know, didn't you do something here? Okay, on today's review, Mr. Seymour's symptoms were subsiding. No, I don't know about were subsiding. Does that mean in the clinic he's sitting there and they're subsiding as you watch him? So maybe had subsided or had improved or something, but were subsiding. That implies they were subsiding when he was sitting there. And I don't think that's quite what you mean. However, his x-ray revealed minor degenerative changes in the left metatarsophalangeal joint. Available to cover it is available a copy of what? What is this it? What is it? Is that the x-ray? So the pronoun it, what does it refer to? Not clear in that sentence. Mr. Seymour has been discussed. So this implies that you discussed him with someone else. And that's not what you mean. You mean you had a discussion with Mr. Seymour. But how this is written, present perfect, in passive, it means he's been discussed by somebody else. And that's obviously not the case. So you had a discussion with him, but this doesn't say that. This says something else. And so that's a good example of how passive doesn't always work, because that is nonsensical. Mr. Seymour has been discussed about a possible synovial fluid sampling in the next episode. What do you mean? Right. So I think from the case, 10 minutes left. I think from the case notes, it means you discussed with Mr. Seymour about when the next episode occurs, you might have to take a synovial fluid sample. That's what you did. But how this reads doesn't say that. It says something else. Advices, advice is uncountable. Advise with an S is a verb. Advice with a C is a noun. So make sure you get that right. Advice was given regarding diet and alcohol intake. Regarding his diet and alcohol intake, please note has been restored to move. I think there's too much passive there. Again, it's overuse of passive. There's nothing to say that you were even there, you know. And again, I don't remember all the notes, but I presume that you were there. But according to this, you weren't, because it's entirely passive. Has been discussed, was given, not I told him, I discussed with him, I did this, that. It's all passive. Okay, I've got a couple left. Let's have a quick go. Mr. Laron, who sends up to sclerosis for assessment and management. Okay, well, and further assessment. Mr. Laron was in real estate, married with 2 children. Who cares? What's that got to do with anything else? He's overweight and a smoker, so he likes a smoke, and he's a fatty. Again, what's that got to do with anything? And he's got depression. Okay, well, kind of, but you've got some things here. So it's like including information without necessarily drawing anything out of it. You know, so he's a real estate agent, and he is married, and he's got kids, and he's a fatty, and, you know. Mr. Laron presented on the 30th with history of fatigue and stress. His examination was unremarkable, except for an increased. So an index is countable, right, except for an increased body mass index of 27 grammatically complete sentences. Therefore, blood, so it's either a blood test or blood tests, were ordered with a review. So you've got your main verb here, were ordered with a review. So the review was ordered with, oh, hang on, that should be an E, sorry. There. Ooh. Therefore, right. A blood test was ordered and a review was scheduled after 1 week, not with a review after 1 week, because it seems like it was ordered, because that's a main verb in the sentence. Okay, on his next visit a week later, the patient presented with similar complaints and also weaknesses. Why is it plural? Weakness in the left leg. On examination, his blood pressure was 90/80 blah, 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 and his BMI had increased to grammatically complete sentence 28.5. Don't write it like case notes. Mr. Laron's possessive, a genitive case, blood test reports were in normal limits or were within normal limits, except for cholesterol, which was increased to. Okay. Hence, the patient was advised lifestyle changes. What was advised about lifestyle changes? For losing weight and stopping smoking. One month later, the patient presented again with complaints of, right, so blackout, it's either a blackout or blackouts. Which is it? No idea. So we'll make it one. A blackout, which was for a few minutes, and a tingling sensation in, is it both hands, in his hands? Grammatically complete sentences. If you don't, you're not going to be getting a good score. He also complaints. Complaint is a noun. Complained is a verb. Complained of breathlessness and occasional constipation. An examination of sensation in the upper limbs, definite article. And what's the sensation in the upper limbs? And so we've got, and a diminished left patellar reflex. Okay. Therefore, a CT scan was ordered. You mean you ordered it? In view of the above, why would it be highly appreciated? Why wouldn't it just be appreciated? Are you going to get an extra special service? It would be appreciated if you could further manage the case and all that, and MRI. Should there be any queries, please don't hesitate to contact me. Okay. Right, I might just have time. I've got 3 minutes. No, well, I haven't got time to do that justice in 3 minutes, I'm afraid. So what I'm going to do, I'm going to open for questions again. So, but 3 minutes, I haven't got time to do that justice. So, anybody got any questions? I've got 3 minutes left. If you have, raise your hand and I'll turn your microphone on. Come on. 3 minutes left. Anybody got any questions? No, I take it that's a no. Okay then. So I'll stop this then, and I'll put the video on YouTube. You can have a look, have a listen, and I'll be in Telegram for a while. If anybody's got any further questions, right, I'll see you then.